We are also going live on YouTube. So if anybody want to see us, they can also refer to YouTube channel. Sir, we may begin the session.
Yeah, we can. Yeah.
Okay, so a very good evening to all of you, and it's a honor to have you both, Dr. Sumant Patil and Dr. Sharmila ma'am. Now we have been talking since last year, and it is pretty evident the wellness should score over illness. And when we are talking about being healthy, immunization is very important. And immunization, as per WHO, is a global health and development success story, saving millions of lives every year. And vaccines should reduce the risk of getting diseases by working with your baby's natural defense system. Now, this is what we have been witnessing and could be able to fight with more than 20 life-threatening diseases with the help of vaccine and helping people of all ages. And today, and since we are witnessing so many development happening today on vaccine, and more or less, if we see every household is looking forward for the new buzzword, which is vaccine today. Highest search word in the internet is vaccine. More we will be learning today from you, sir. And Dr. Patil, Dr. Ma'am, Sharmila Patil ma'am will also take us through the early intervention. And at times, we lose out many times, many precious months, year rather, and then subsequently we have no choice than to go through the social trauma. So we will be learning from both of you today, ma'am and sir. And I'm the best mom. This is a platform where we spread the awareness of wellness and let us spread, learn, and practice at home. And we have made it so customized for children, for adults. So we are having everyday yoga session for children. We are teaching the language. So there are many things to capture from I'm the Best Mom platform. Now, be it nutrition, be it with emotion, we need to spend time this is what we have learned from last year. So let us enhance the capacity of building our wellness. And today we'll be spending more time on this. Now I will not consume the precious time. So over to you, Dr. Suman. Before I give it to you, it's a pleasure. Let me introduce you to you all out here. Dr. Suman Patil comes with huge amount of experience. He's the MD pediatric and MRCPPS from UK, DCS from UK. He's a fellow pediatrician with the critical care and neonatology, which is his domain, and in charge of the pediatric intensivist with Dinanath Mangeshkar Hospital, Pune. He's the IAP ICC fellowship holder with the director, national faculty, and the trainer with IAP EPIC course. Dr. Sharmila Sumant Patil, ma'am comes with a diploma in child psychology, fellowship in development and behavioral pediatrics. Director, Jellybeans Childcare and Development Center, Wavdhan, Pune. She is the consultant development and behavioral pediatrician at TDH KEM Hospital. Ma'am, you have been seeing so many challenges in the last so many months, and today, please share your valuable input, which will matter to many families. Now, let us begin the session with Dr. Suman.
Thank you.
Okay. So I'll share the screen then.
Yes, sir. And I would request the attendees can put their question on the Q&A section, which we will be taking during the session or maybe towards the end of the session.
Okay. Okay, good evening, everyone. So as we were discussing about something very important, which is immunization. And immunization is the best form of prevention. So it is better to have your child immunized and vaccinated rather than waiting for him to get an infection and then develop the immunity. So we want to emphasize certain important things here. So let us go back into the history of immunization. So this is a very historical picture that you can see. I mean, none of you would have seen this picture and these kids. The smallpox was eradicated globally in 1979, and it was the major disease which was disrupting the lives of so many kids throughout the world before that. And actually, the formal immunization, when it came into picture, before that, this inoculation of smallpox was practiced 2000 years ago in India as well as in China. And actually, till the time Edward Jenner came in a picture, the actual concept of today's immunization didn't materialize, and from there onwards the immunization took off. So what exactly do you mean by immunization? It's actually a process where you give a vaccine to a person and try and protect him from the disease. So what vaccine does is it tries to mimic the disease. It actually doesn't give you a disease, but it tries to mimic the disease, and by mimicking the disease, the body responds to it in a different way and produces the antibody and protects the person. So let us go back and start with what WHO was trying. In 1970, most of the Western countries were free from infectious diseases. But what they realized that most of the developing countries and the poorer countries are still struggling and having a very high mortality rate. That means a lot of kids were dying with infection, and which could have been easily prevented by giving vaccination. So what they decided that is they launched a program called Expanded Program on Immunization, EPI, in 1974. And which was basically the first aim was to protect against the 6 killer diseases, and mainly for the developing countries. So tuberculosis, polio, diphtheria, pertussis, tetanus, and measles. And as the program started becoming more and more successful, they started adding up the vaccinations into that. And now at this moment, we are having almost up to 20 diseases which are being covered with the vaccines as such. So this EPI is the program that started with all the vaccination here. Now, if you look at the progression from there onwards in the world, in 1974, when WHO launched EPI, in 1990, they went further, and then vaccination started protecting more than 80% of the world's kids from these 6 diseases that were infection diseases. And in 1990, the Global Alliance was formed, which was sort of an further extension of the EPI. And now see, these many vaccines are available for these many diseases that you can see, and there are a few more added. So if this slide actually tells you what happens from 1980 onwards till 2018. So that's such a long period, and over this period, how it started. So you can see all these color coded things. They are actually representing the various vaccines, the main vaccines, and how the first 3 vaccines started in 1980. There were only 20% coverage at that time, and by 1990 it achieved nearly 80% coverage, and from there onwards it was going up. So gradually from 1990, hepatitis B joined, then HIB, the H influenza B joined, and then followed by that there was the measles also picked up. The measles also picked up in 2000s, and by 2005 rotavirus as well as pneumonia vaccine has picked up, and now they are now reaching gradually up to the 80% coverage as we would expect them to be. India. On this side, I must say India has done extremely well, and it's the biggest story of the 21st century, that what India did, that we got rid of polio almost there. We're almost there, that the polio is almost eradicated. We launched our first vaccine in 1962. BCG was our first vaccine to begin with. Then EPI, obviously the WHO program, was launched in India in 1978 for first 6 diseases. You can see this iconic picture. Now you don't see these kids now anymore because polio we don't see now. The Pulse Polio program started in 1995, and by 2012 we had 0 cases in India, and we went on to surveillance program from there onwards before we being declared as polio free. And this is the biggest success story in Indian scenario. So that's a great achievement as such for Indian government and for us as a nation. So this is our first question. Let us say how much you know about this. You need to just keep in your mind and let me know which disease this picture prevents. This picture shows. And this is one of the
this question can be also participated by the panelists. We have already posted here. So the panelists are the viewers are also requested to participate out here.
Great. Okay. So
let us wait for a few seconds. So what is the vaccine preventable infectious disease of childhood? This is the question.
I think many people are participating. I want everybody to give their opinions. I think they're doing well. You still have a few more people, 50%. Look at the picture. You might have seen this. Nowadays, you don't see many, but you still occasionally see this one.
Okay, so let us share out here.
Right. The answer is?
So around 50% is saying it's measles.
Yeah, so that's...
And people are a bit confused whether it is chickenpox as well with 44%.
That's right. So let's go with the 50% majority. Yes, this is measles. You're right. It many times closely resembles chickenpox, but if you see, there are no vesicles. I mean, these small fluid-filled vesicles that you don't see here. It's a flat rash over the body, which is what the measles is characteristic of. Great. Okay, let's go ahead. Okay, I'll cancel this one.
Yeah, sure. It's already done.
Okay. So, so now let us know what exactly immunization means. Now, see what vaccine does. Vaccine does 3 important things. It recognizes, it produces, and it remembers. So what does it recognize? It recognizes the invading germ, such as the virus or bacteria. So when you get a vaccine has a similarity towards the germ that you would actually get an infection with. And so body remembers that. And then it produces antibodies. The antibodies are basically your soldiers. So body produces these soldiers to fight against the disease. And it remembers this time that this is how the disease looks like. And when next time you're exposed to the similar kind of germ, the body actually reinvents itself and says, okay, no, I know this, what it is, and I know the antibodies, I already have it. And then it quickly destroys the germ before it actually gets over into the system and causes the actual disease. So what it does is, it is like similar to the natural infection. Now, if you look at this picture, the natural infection is going to give you the immunity, similar to what we are thinking about. But at this same time, vaccination also does the same thing. It also is going to produce antibodies and give you an immunity. But the difference is natural infection is going to give you a disease itself. And in the disease process, there could be complications of the disease, such as in measles, you can get a lot of complications. Like you can have complications of brain, complications of your chest, you can get encephalitis, you can get otitis, that means the ear infections, children can go into malnutrition. But vaccine doesn't do that, but it produces the similar kind of immunity, and that is why vaccine is preferable. Okay, now what are the types of vaccine? Let's look at those. So basically, there are live attenuated vaccine. That means actually the vaccine contains a similar live germ inside it, which will produce a response to that and produces the antibodies. And there is second one, which is called inactivated. That means the germ kind of is killed and it produces some sort of antigens, and these antigens are used to produce antibodies. So that is inactivated. And subunit is these antigens, when they are sort of made more purified, they do not give that much amount of immunogenicity. That means they do not give very strong reaction as compared to the plain inactivated killed antigen. And then of course there are toxoid and inactivated toxins. The toxins they use, they're used to produce the immunity, but they do not create the disease. So these are the 4 types of main vaccines for the technical purposes, but they're all the same. But what we should remember as such is that the way we give these vaccines. So you give vaccines orally, then you can give vaccines, which is the most common, as intramuscular vaccine, as an injection. And there is a subcutaneous vaccine, slightly higher up, not into the muscle. And then there is a intradermal vaccine. Intradermal is not into the muscle, not into the subcutaneous zone, but into the just under the skin. So that is called as BCG vaccination. So that is intradermal. And these manufacturers usually recommend the route of administration and which way the vaccine should be given. So these are the number of vaccines that are given orally: OPV and rotavirus. The intramuscular vaccinations are these: hepatitis B, IPV, Hib, and pneumococcal. Subcutaneous vaccines are measles and yellow fever, and intradermal vaccines are BCG. Right. And how does a vaccine prepared? So vaccine is prepared in a way that they undergo certain, I think you must be familiar now with the words nowadays which are going around: phase 1 trial, phase 2 trial, and phase 3 trials. When you initially start trialing and seeing the vaccine in healthy volunteers, then there are number of volunteers are increased in phase 2. And in phase 3, there are hundreds of thousands of volunteers, and there are comparison with the disease and the normal disease and the vaccine, giving after the vaccine, what the response is. So this is how the vaccine is developed and approved, and then it is manufactured. So this is where it gets manufactured, comes down, and it is used in the form of cold chains for the transports, and then it goes to the destinations where it should be, and it goes with the healthcare system, and then healthcare personnel give you the vaccines. Okay, so what do vaccines do? Do they have any problems? Do they create any problems? As such, vaccines do not have major side effects. Normally, what you would expect with that the body will react, because it's a foreign substance that is entering in your body. So what will it do? It will just give you the most common ones are usually there will be some redness, there will be some amount of pain, swelling, and itching at the site of injection. Then there are some generalized side effects such as fever, malaise, and a headache, and some rashes all around. And then obviously the very rare one is the anaphylactic reaction, which is extremely rare side effect of the vaccine, and we hardly see them, but it is there and documented. So National Immunization Program is what the IAP, that Indian Academy of Pediatrics, has developed along with the Government of India. And this is the organization which is responsible for updating this vaccination program or immunization program every year. And it has to take into account what is the current situation of the disease, where it is spreading, and accordingly it advises to add or reduce certain amount of vaccination. And also sometimes it takes into account what is the current global scenario and whether we can include those vaccines in our national immunization program. So that's IAP's program. Now, this will be a second question for you. So we just spoke about polio. Does anyone know when was India declared polio free? 2005, 1999, not yet, or 2014? Let's see. We need to have lots of participation.
Yeah, we'll wait for another 5-10 seconds.
Okay.
So around 57% says it's 2014.
2014. Yes, I think you all are right. But there is the third option, C. It still can be technically right as well, because if you say 2014 is actually when we declared that we do not have polio anymore with us, but we have not declared ourselves as eradicated. I mean, the polio is not completely eradicated from India because we are still getting some vaccine induced cases. So we are free from wild polio virus infection. So we don't have wild polio virus infection, but we do have some sort of vaccine induced polio cases. So technically speaking, we are free from the polio from 2014 onwards. Okay, right. So let's go to the next one. Right. Let us look at our national immunization, IAP's national immunization program. You must all be aware of this. We usually have it, we start at birth, we get 3 vaccines at birth. The BCG vaccine for tuberculosis, the OPV vaccine for polio eradication, that is oral polio vaccine, and hepatitis B at birth. So we start with that. And then we go on to have major vaccinations from 1.5 months onwards. We usually have it, we started. So 1.5 months, that is 6 weeks. The second lot at 2.5 months, and third lot at 3.5 months. So that's exactly the same set of vaccinations. Nearly 8 vaccines are given, which includes DPT, pneumonia, rotavirus for diarrhea, Hib is for meningitis, and IPV is part of polio and hepatitis B. So these are our important first lot of vaccination in the first 3.5 months of life. Then comes your next vaccination. So next vaccination starts at 6 months. So we vaccinate our kids at 6 months and 7 months with flu vaccination, which actually every year changes according to the strain, which is more common in the world. And usually it is advisable to do vaccination for kids under 5 every year, annual vaccination, after you do the first year vaccination. Then 9 months is obviously MMR, that measles, mumps, and rubella. 10 months comes typhoid. Then 1 year there is addition to that is hepatitis A, and a new vaccine, which is Japanese encephalitis, which is becoming more and more common now, more mainly in the northern. It used to be in the northern states and some of the areas of Andhra Pradesh, but now it has spread over to many districts in India. So it is now included as a routine vaccination. And then there is a pneumonia booster in 14 months, then 15 months second MMR vaccine with the first chickenpox vaccine, followed by first booster of DPT, Hib, and IPV, which is at 1.5 years. There comes the first lot of immunization, which completes. And then 20 months onwards, we get second lots of hepatitis A and chickenpox, followed by a typhoid booster at 2 years. And at 4 to 6 years, we normally do the second booster of DPT, HIB, MMR. And then at 10 years, we do a DT, third booster of diphtheria and tetanus. By 12 to 15 years, the new recommendations are human papilloma virus, mainly for girls, first and 2 vaccines, 6 months apart, and this is to avoid cervical cancer. And beyond 2 years, now a major vaccine which is coming up is the meningococcal vaccine, which now was mainly or purely a Western disease and has started to appear in India as well in a big number. So that has been included in the vaccination schedule. And this is our current vaccination schedule, which IAP has recommended. I'm just showing you this whole picture of 2020 to 21 vaccination schedule, which was just released by IAP few weeks ago. It's a bit complicated, but this is what actually I have shown earlier on in the previous slides. Now, let's go for the third question. Let us see, what do you understand by BCG? So what does it stand for? A, bacterial cloning growth. B, big clever gene. 3, Bacillus Calmette Guerin. And 4, Bifidus Cramium Granulus. So let's see what it means. Try as many as you can. It's a good number voting this time, nearly 70%.
Right, sir.
Okay. So actually, the answer I think most of the people had said is A, 48%, but it's not right. The correct answer is C, Bacillus calmette Guerin. Okay. So remember that BCG vaccination is for tuberculosis. Great. Okay. So let's go to the next slide. I'll cancel that. Right. And let us look at what WHO is planning to do. WHO has a proper immunization agenda now for next few years, particularly looking at 2030. So it is a people-focused approach and country-owned. So every country is going to own the vaccination agenda and going to go ahead with this agenda for the same purposes of eradicating certain diseases. And it is always going to be a global partnership with the current country. And it will be data enabled. That means every vaccine and every patient will be documented. And this data is going to give us a clear-cut idea whether we are able to eradicate any diseases or not. So a world where everyone, everywhere, at every age gets the vaccine. And that's what the vision is. And there are full benefits from the vaccines which needs to be given to everyone. And for the good health and well-being, we should ensure adequate vaccination for all. And this is the immunization agenda of WHO for the time being at this moment. And another program which is launched by United Nations in 2015 was Sustainable Development Goals. Now look at this chart that you can see. We are number 2 in the world for under 5 deaths. You can imagine even Pakistan is below us. And who are we below? We are just below Nigeria. Otherwise, we are the topper in the world for under 5 deaths. Literally, the countries that those are under us are, even Bangladesh is right at the bottom there with only 90 deaths for under 5 in 2019. So we must work very hard for that. So our targets by 2030, which are the Sustainable Development Goals by United Nations, are to reduce the newborn mortality rate to at least as low as 12 per 100,000 live births, and reduce the under 5 mortality to at least 25 per 100,000 live births. Okay. So we have a big task in our hands. And remember, the COVID has actually done a lot of damage to these numbers because of the COVID, actually the vaccination coverage in most of the countries has dropped down because people were scared to come out, and most of the children could not get their vaccination on time. And this is very important actually. So they have warned very significantly that the drop in vaccination is of a concern. So remember, the vaccination itself is far more important to protect kids from the infectious diseases, which are actually the killer diseases than the COVID. Okay. Now the most common and most preferred or most anticipated topic is COVID-19 vaccination. Yes, it's there. It's there. It's just announced that the vaccine is approved for use. That's the Covishield, Serum Institute of India, which has produced that with Oxford AstraZeneca. It's a replicating viral vector vaccine. There is another vaccine which is going to be produced in India. It's a indigenous vaccine, whole cell activated vaccine, which is actually the technology which is used in all pediatric vaccination and which is being produced by Bharat Biotech India in Hyderabad. And the other 2 vaccinations which already have started vaccinating all over the world, particularly in Western world, UK and USA, is Pfizer's and Moderna's vaccines, which are using completely different technology of messenger RNA molecule. All 3 vaccines are proven effective in preventing the disease as well as the serious side effects of the disease. So what is current plan for this vaccination? The current plan would be as per the risk of exposure. So there are 2 doses which will be given 1 month apart. Mainly the first as of course that you would expect that the frontline health workers, healthcare workers would need to be vaccinated first all across the country, even all over world. All the health line workers or healthcare workers have been vaccinated. The second would be first responders like the paramedic staff, police, then civil servants and army, because they will also be looking after the vaccine and the epidemic. And then comes the elderly population, which will be more than 60 years, followed by population above 40 with comorbidities such as severe diabetes, poorly controlled diabetes, hypertension, and other illnesses. And then will be the normal population. Children are really at the bottom of it. You can imagine the vaccines have not been tested. The COVID vaccines are not been tested for pediatric age groups, and they're not yet recommended for pediatric vaccination. So anyway, because the kids are not developing serious kind of COVID illness. So that's the information that you need to take into account. Do not fall into prey for any other, people coming through or the false notices coming through WhatsApp and anywhere else. This is the clear-cut important information that you need to keep in mind. Now, my last question. I'm sure everybody knows this. So, what this ad stands for? Do Boond Zindagi Ke. So, is it for Kaun Banega Crorepati? Is it for Pulse Polio campaign? Is it for Navratna Tel? Or is it for Swachh Bharat Abhiyan?
So the answer is pretty quick this time.
That's great. Actually, that's right. Almost 95% people have said it's Pulse Polio campaign. That's correct. So Amitabh Bachchan has been campaigning for Pulse Polio program. So it usually happens every year in the month of January. This year it may not happen because of the COVID, but you get your children vaccinated with the current immunization schedule that is on. Okay, so so what am I going to tell you today? Most importantly, so routine vaccination is the best form of prevention. Do not hesitate to get your child vaccinated on time. It helps to develop immunity and protection against deadly and killer infectious diseases. It's much better to protect your child. Always get all routine vaccination on time. Some amount of delay can be accepted, but not more than say 2 to 4 weeks. No vaccine creates any major side effects worse than the disease itself. So don't worry about any side effects of the vaccine. Vaccination that's why it's very safe and it is essential. What we need for that is we need to have our children healthy, and healthy children will lead to healthy communities, which is the basic aim of vaccination. I hope we're clear on this front. Thank you very much. I can take all your questions as per the plan, either at the end or in between.
We can have the questions in between from the attendees, but we will be taking it soon after ma'am's session. So if you can switch up the slide.
Right. Okay, so I will get into the second slide.
Right. So pretty informative, and I'm sure a lot of parents would be seeking to understand more about the way these vaccines are been done, and I'm sure they must have given many vaccines to their children. Some must have skipped. Some, I'm sure this question will be on the way. And before we get into the question, I think the next session is from ma'am. Ma'am, can I have ma'am on screen?
Yeah.
So by the time this screen get activated, so early childhood intervention is definitely, it's a support system, and it's an educational system for very young children, starting from their early from the birth to the milestone, whether the children are achieving or is there any other challenges in the way. Today we will be having a lot of clarity on that. Sir, you were able to share the screen?
Yeah, just a minute.
Sure.
Okay. We all want what is the best. Good evening. I'm Dr. Sharmila Patil, and I would like to talk about early intervention. We all want what is best for our children, but practically it is not possible. So, as young parents, we need to know what are our child's needs, the child's normal development, growth, and the red flags of normal development.
So for just a minute, So what is development? Development is a continuous process that occurs from the conception till the end. So as you know that development is a continuous process. So we need to focus on the early childhood because that is the maximum years of the age.
The screen could not be started. I would request if you can stop and share again.
Okay, just a minute. Need to have screen is not getting shared. He said stop sharing and start again. Yeah, can you see now?
Yes, absolutely.
Should I begin from the beginning or I'll start from?
No, I think you can carry on from here.
So it is a dynamic and complex process that begins from birth and typically in a predictable sequence and a predictable rate. So that there are different developmental things like there is deviance, there is abnormal development, but we have to stick with the normal development. And as a young parents, you should be having roughly the know the milestones, and you should be checking when you go for your immunization schedule to your pediatrician, and you should be tallying because nowadays in many immunization cards they have put the developmental milestones. So you should be judging whether your child is running through or is going appropriately on the developmental scale. So as per what I was saying, that health science in India is tremendously changing with increasing NICU graduates, that is NICU because of the neonatal services, and many NICU graduates are coming alive outside the NICU after 1,000 days. And that's the reason the awareness of child development and its issues has increased in current years. So parents are more worried about their child's development and optimum development. Many parents come across and ask for to their pediatrician, their concerns regarding development, behavior, and growth. Many kids' issues are resolved as they are minor and they can be easily rectifiable and solved, but small and but significant proportions may actually be the harbourers of neurodevelopmental problems. So the primary role of every pediatrician is to support and facilitate optimal development of children. Developmental experts are stressing on early identification of developmental problems. So development is intricately influenced by combination of genetic, biological, psychosocial, and environmental factors. So as I told you, it is the need of the hour and increasing importance as awareness and NICU survival rate has increased. So what is the global prevalence for early intervention? WHO estimates that 15% of world's population lives with some form of deformity. Developmental delay is reported to be 1 to 3%, and increasing survival rates of NICU graduates, that is high-risk newborns. This is again and increase the prevalence rate of developmental problems. Low socioeconomic status, malnutrition, lack of stimulation adversely affect the prevalence rate of developmental disorders. So we kindly need to get into note that early stimulation is very essential. Early picking up is very essential. So what is
Early intervention. Early intervention is systematic and planned efforts to promote development through series of manipulation of environmental and experimental factors initiated during first 5 years of life. So according to IAP, that is Indian Academic of Pediatrics, and as well as American Academic of Pediatrics, has set guidelines mentioning the routine surveillance at every visit and timely screening of child development. So this is not only for high risk or for some child who is having problem. It is a routine for each and every child to have the developmental surveillance. So what is developmental surveillance? Developmental surveillance is just going informally questions, asking and checking whether your child is growing according to the milestone set. You also should be doing developmental screening and asking your pediatrician for that at 9, 18, 24, and 36 months of age. Developmental screenings are formal standardized tests, which are the questionnaire which you answer and you are assured that your child is growing in the proper limit. So high risk follow-up, there should be more frequent visits. If your child is in an ICU admission or had any problem during birth, your visit should be frequently to the developmental pediatrician or your pediatrician. So what is it? What is early intervention? It is just nothing but stimulation, stimulation, and stimulation. It is based on the theory of nature and nurture concept. It plays nature and nurture concept plays an extremely crucial role in the development. Stimulation in the form of, in what form do you stimulate? Do you give any injectables or do you do any other therapies? Yes, it is in the form of age appropriate activities and play with language rich environment for the child, which is lagging nowadays because of nuclear family, working moms, working dads. So we don't have time to really bond with our little ones. What is the need of the hour is bonding with your little one, understanding your little one, and having a perfect emotional bond through touch, through different other means. So when should you start the early intervention? As early as possible, and recent and enough evidences are over the years tells us that early intervention can have positive impact on functionality of the child and improve long-term trajectory. So it is very essential to start it as early as possible and not wait for 2 years if the child has some birth asphyxia or so preterms or early extreme low birth weight babies. Do not wait till you find some abnormal signs and symptoms, but do the early intervention because it is causing no harm but just the stimulation. So, what are the eligibility criteria or who needs it? Kids with motor, communication, socio-emotional, cognitive, adaptive, and global delay. Children with genetic syndromes, child neglect and abuse, high-risk infants who has the biological risk of low birth weight, preterm, birth injuries, prenatal and natal surgeries, developmental delays, cerebral palsy, again epilepsy, autism spectrum disorder, intellectual disability, ADHD, learning disability, sensory impairment like hearing loss and visual loss. For hearing loss, if you check at the first month, if you confirm by 3 months and if you start by 6 months the interventions, the 99% of children can hear even if there is a moderate to severe, mild to moderate hearing loss. So that important is early intervention, early identification, and early doing something for your child. Environmental risks like poor nutrition, low socioeconomic, single parent, lack of stimulation, poor mother-child emotional bonding can all lead to the newly developed neurobehavioral disorders. So what is the principle or the theory behind early intervention? You all must be aware that neuroplasticity, it refers to brain's ability to learn, remember, forget, recognize, and recover from the injury. So the neuroplasticity is the basic theory. The concept was put forward long back by Hebb in 1949. And it says that neurons that fire together also work together. Structural and functional changes in the brain brought by training and experience. And as the brain is the dynamic organ which changes with experiences. So plasticity of brain is maximum in early years of life and through continuous and reduced rate throughout the life. It is more in certain parts of brain than others and more in certain periods of life than others. Children are able to recover from injury much faster than adults. So why do we need it? So as you know that during birth, after birth, there are 7,500 connection and they increase rapidly in first 2 years of time. So early age period, synaptic connections are doubled. The amount and repetition, consistency of stimulation gives more synapses are formed and they are strengthened and preserved. So early years have enormous impact on brain development, behavior, learning, and memory. And so it is very important to start early. So this is I've given a slide where you see the neuronal connections at various ages, like at birth, what it is, then you can see that at 6 years, it's the maximum. And then at 14 years, it's little bit fed off. And this is the slide showing that repetitive practice that increases synapses network before stimulation, then 2 weeks of stimulation by different physical and cognitive activities, and then the increase of synapses by 2 months after stimulation. So what are the steps of early intervention? First is identification. And to identify, as I told you, you have to have the developmental surveillance and screening, providing early effective support in form of therapies, treatment, and it should be holistic. I mean, if you're only the child is not walking, so I'm going to physiotherapy, and you just attend physiotherapy and think that, okay, he will talk, my child will talk later, he's just 2 years old, he's just 2.5, he's just 3. No. Try to seek the help of the expertise as early as possible and implement those things at home. Start working with your child. Home therapies, take it from your professional experts and start intervening with your child as early as possible. Prevention can be at 3 levels. First is the primary. We are, the tremendous work going on in the adolescent health of girls and boys to improvise their health, because now there is much more research going on that are the neurodevelopmental or behavioral diseases or disorders connected with the bad or poor ill health of the adolescent, and do we feed our adolescent properly and prevent the occurrence of disability. Secondly is the helping in preventing further deterioration and complications. So by the time all the kids come to me, they're 2 years 3 years old, and they have passed few age time in their growth and development. So still we are working at the secondary level to prevent further deterioration and complication. But it will be a boon if we start preventing at the primary level. And the tertiary is achieving maximum functionality in all 5 domains, ADLs, and make them independent. So the aims of early intervention is identification of infants at risk, identification of developmental delay and deviance, enhancement of normal development, acceleration of rate of development, acquisition of new behaviors and skills, increase in independent functioning, early detection and prevention of secondary complication, minimizing the effect of handicapped conditions, and psychological support to the families, cost-effective and holistic management. How do you do it? So how you carry on these early intervention programs? It focuses on stimulating your babies or toddlers to learn the basic and brand new skills that typically develop during first 5 years of life. So you either do physical and sensory, that is gross and fine motor, or you do the cognitive stimulation by giving them different puzzles, learning, solving problems, communication, talking with your child and not handling the mobiles, listening to your child, developing the social and emotional bond, playing with your child, which is very, very necessary. And I would like to ask, how many of you play with your child? Adaptive, like self-help, eating, dressing. Most of the moms, they have to go to the office, so they quickly feed their child, quickly dress their child, and do not develop or do not give time to child to adapt to their own needs or do their own things. So early intervention in different scenarios is like high risk follow-up. Intervention should begin from the NICU itself. For cerebral palsy also, early identification by GM movements and doing stimulating exercise as before 1 year of life. For autism spectrum disorder, you know that we have to spend 15 to 25 hours of intervention per week, which is not possible by going to the therapy center or to any therapist. So please start working on your child and you be your child's best therapist. Learning disorder, again, is an evidence-based reading intervention which brings about significant and durable changes in brain organization and activation of the left occipital area. So there is a proven science that if you give the remedial teaching at the appropriate age, the child can do pretty well. So what are the benefits? As I told, minimizes the developmental and behavior problems in children at risk, and they maximizes the potential in children with developmental disabilities. The only example is that when the parents come with poor social communication and interaction in my OPD, and I ask them, please stop the screen. The next visit when they come, they say, yes, he's little bit interacting. So you yourself are the witness of the things, that how much time you spend with your child, you're going to get it back. Early intervention services combined with child-focused educational activities and strengthening of child-parent bond are most effective. It also improves the cognitive ability of the child and receives the multidisciplinary in early intervention services as compared to children receive only health services. So psychosocial risk factors that can have negative impact on early intervention services. Therefore, effective management of them is essential for proper functioning of early intervention. These are the few slides. They are not very clear, but these are the slides which can show you the different activities your physiotherapist or your occupational therapist giving you for head control, child with spasticity. And if there is a hearing, if you are doubting about the hearing, speak with eye-to-eye contact to the child, speak clearly, do repetition of what you say, use single language, talk to child whenever possible, call the child with one name only, don't keep on changing the name of your child, make the child listen to different sound, promote symbolization like pointing, taking names of common objects when it comes in front of the eyes. So this is the type of early intervention you can do, or stimulation you can do at the home-based program. For vision, you can hang brightly colored objects at 12 to 15 inches above, hang black and white strip or cloth across the crib. The mother, while maintaining eye-to-eye contact, do singing, talking, keep facing 6 to 8 inches away. Bright colored balls or balloons to be hanged to promote visual following using multicolored small bulb series or even the torch light. So for speech, you can encourage your baby to make a vowel-like sounds like ma, da, ba. Reinforcement attempts by making eye contact, responding with speech, imitate child's laugh or facial expression. Teach your baby how to wave, how to throw cases, play finger like peekaboo, pat a cake, or talk to your baby while you're dressing, changing nappy, feeding. The small touch, the tactile touch while you're feeding has proven to improve the emotional bonding. Use good and clear speech. Repeat what your child is saying, indicating that you understand. Build and expand on what he has said. Like if he says, I want fruit, you can ask him, do you want fruit? Say, I want apple. Do you want apple? Yes, I want apple. So this is the way you stimulate your child to talk. Use baby talk only when needed, because it is natural that we talk in a baby talk and then we again complain that child is almost 5-6 years and still he's talking with baby talk. So you need to use baby talk only when needed. You can expand your child's vocabulary, teach him body parts, simple songs, nursery rhymes. Instead of showing on the mobile screen, you sing the rhyme for your child. Do not use screen mobile, as it is one-way communication and not recommended below 2 years of age. Instead of that, use family photographs, keep telling and talking about your family, tell small stories, ask your child to repeat the sequences. When child is talking, pay attention, and make child is also paying attention when you're talking. Continue building your child's vocabulary, involve your child in day-to-day activity. So, in case of attention deficit hyperactivity disorder, the early, as 3-4 years, you know that your child cannot sit at a place for a longer time. So, from the early age, if you have some physical exercises, ask your child to meditate, you may increase the period, prolong the period of medication. And there is a point, early you diagnose the early children who are diagnosed under ADHD. We do not prefer giving the antipsychotic drugs, but you can prolong the time by doing these small early interventions at home. So I think I finished my talk, and I'll have few questions for you. So my first question is, development is one-time process. Is it a true or false?
So the participants can vote it here.
Wow, very good. That shows that you were attending. It's a lifetime. It's a continuous process. Good. I hope you finished. Yeah, correct. It's a continuous process which actually has a initial phase. It is very concentrated, but it is a ongoing process. Correct. Just a minute.
Ma'am, the second question is the principles behind early intervention.
So what do you think? What is the basic principle behind early intervention?
So the options are, neuroplasticity, synapse and pruning, stimulation, or all the above.
I think it's a little bit confusing for them, but I mean that all the above is needed because they are the part and parcel of the neuroplasticity. You need the stimulation, you need the pruning and all those things, and as well as neuroplasticity is the basic science behind early intervention. Yeah. Next.
Now with this, we are also asking, is the developmental screening test or blood test, whether it is true or false?
Very correct. It's not a blood test. It's just this different standardized assessments questionnaire, which psychologist or your pediatrician or developmental pediatrician ask you during your visit to them. Yeah, very correct.
So 100% is saying
Yes.
false.
Good. There's one more, I think.
No, ma'am. These are the poll questions.
Yeah.
So, ma'am, we have a few questions on the way.
Yes, just finish with my last slide. Sure. The child must know that he is a miracle, that since the beginning of the world, there hasn't been, and until the end of the world, there will not be another child like him. So from the day one, put the emotional, social, or work on all 5 domains and develop the confidence in upbringing your child and put all the emotions and make your emotional bond with your child very perfect. Thank you. Yeah.
Thank you. Thank you so much, ma'am.
I'm very sorry. Dr. Patil has gone for an emergency, so he is not available to answer the questions. He had an emergency from Didanath. So are there questions for him or for me?
Well, there are questions for you as well as for Dr. Sumant, and
Okay. Yeah.
uh, let us begin some of the questions
Yeah.
which
Sure.
has been asked to Dr. Sumant since
Yeah.
Sir is not here. Ma'am,
Yes.
if you could answer some of those.
Okay.
Now,
I'll try my
uh,
best.
yeah, one of the
Yeah.
question is coming. What is the meaning by vaccine-induced cases?
Vaccine induced cases. Okay. Is it written here? Okay.
Yeah.
Yeah. I think he is the right person to answer that, but probably sometimes by giving vaccine, sometimes you see the same effects what are the caused by the infection. So they are minor and they can be the reactionary effect. That's what I feel. But if you want, we can ask him to answer them later. Is that okay?
Should be okay, and
Yeah.
if need be, we can also capture it on the
Yeah.
Westmom website.
Yes. Yes.
Ma'am, there is another question. My child is 5 years and missed couple of vaccine, and she's doing absolutely normal. Now, is it a point like can we give the vaccines now?
Yes, you can start. I mean, if you there are some boosters. If you have missed few vaccines, which are what it depends on what vaccines you have missed, and if she's a female child, I would say that it's better you give MMR and all those because those vaccines are necessary for further life time also. But few vaccines can be given as a booster dose but not necessary to follow the exact schedule because you have missed them. But some booster dose of the vaccines which you have missed can be given. And optional vaccines like typhoid, chickenpox can be given at any age. So you can go for that vaccines also. But if you have missed the basic vaccines, I think only the booster can what we can give now.
Okay, ma'am. Thank you. There is a question from Sonali Rani. She is asking what is the main reason for child having a behavioral disability? Where she's saying as a couple they were absolutely fine, but the child is having this issue. He was born with 3 kg weight and was born in full term.
Mhm. What can she specify behavioral disability means what exactly she mean?
Well, that's what she has not captured, but must be
Is it
some.
a neurobehavioral disability, neurodevelopmental disability? What she means?
No, I think she has not specified. Could be
Okay.
with a behavioral.
All right. If it is neurodevelopmental disability, there is no cause or reason, specific reason found for neurodevelopmental disorders or disability. There are many evidences and there are research going on to find out the exact cause, but there are different theories which are saying that the mother's good health is very essential, and moreover the psychology of the mother, she should be happy, not stressed. Secondly, these are all different theories: epigenetic, genetic, environmental factors. These are the therapy contributing, but there is no exact cause found for neurobehavioral disorders.
And ma'am, many times the debate is there: does vaccine cause any of the neuro
Disability?
disorder,
No,
disability?
no. There was in UK, I think that was a wrong publication, which was very much clarified. The reason, it was the MMR vaccine is causing autism spectrum disorder. No, but that is not proven, and it has been disproved that no vaccine can cause neurobehavioral disorder.
And that's what was the question from Mansi. And
Mhm.
when we are talking about children with hyperactivity,
Mhm.
and when we are managing them with early intervention,
Yeah.
now, is there any tools or something which they can follow as a curriculum, or how to identify? Say, for example, as you said during your
Yes.
presentation, there is a milestone which they need to be very, very watchful. If the
Yes.
child is not behaving as per the milestone, as per the age, uh, then they should be sharing it with the clinician, the pediatrician, and
Yes.
they should report it.
Yeah. Yes, there are different tools. There is even parent questionnaire which parents can go through. There's a Vanderbilt questionnaire which has a parent as well as the school teachers rating. So when you visit, they ask you different questions in different headings. And if you find by your 3 or 4 or 4 to 5 year old child is coming in the scoring higher in the particular sessions, then we label as a at risk of hyperactivity or ADHD, and we start the early intervention by having a schedule, having a firm parenting. Secondly, doing some physical exercise and meditation. That is for the early age group. For middle age group, where the schooling or above 9, 10, we prefer the behavioral modification along with the medication. And for inattention, we prolong the medication as long as we can, but at some point we have to give the medication for inattention, because hyperactivity decreases as the age advances, but inattention remains the same. So we have to treat the inattention.
So, ma'am, the global authorities are saying it could be starting from the zero age, from the very beginning of their birth, to maybe the age group of 6. This is a time where the child, maybe the physical organ as well as the behavioral or as the mental abilities also uh, uh, goes through the maximum kind of exposure, right?
Yeah.
And when we are talking about a low birth weight, which is, and you say even the children who are surviving through the NICU care, and like what are the major things they should be very, very watchful for those parents?
See, first thing, because what I have observed that low birth weight NICU graduates, then they try to keep their child isolated, and that result into social, no social interaction. So that I know you are worried about the infections and different thing, but at the same time, allowing your child to grow and teaching your child different skills, age appropriate skills, is very essential. So because the child is the only child, or the child is very low birth weight, and as you graduate, mother tries to keep on feeding the child rather than allowing the child to eat by his own hand at the age appropriate time, is one thing. What is overprotection or less stimulation? So
Right.
what is necessary for such mothers, that take your infection care, due infection care, but not by overprotection, but right protection. So stimulating your child by sending in all 5 domains, like gross motor, fine motor, language, and social. Social is very hampered because of the child is not exposed to other relatives or other people and just isolated.
Ma'am, the question which you had to Sonali, C has clarified the behavioral disability is more towards the child is diagnosed with ADHD, and how best the medicines can be given to the hyperactive child, and does it cause any kind of issue in child's overall development?
See, the medicine used for all neurobehavioral disorders are antipsychotic drugs, and no drug is good. So we try to postpone the drug, but as I told you, that inattention you have to give, but still there is a IAP guidelines saying that till 6 years of age, or till you should not be giving any antipsychotic drugs, and managing by the first preference of behavioral modification and changing the lifestyle. But in some cases, even by 5, 6 years, sometimes when it is not possible to control the hyperactivity, then we definitely take help of few antipsychotic drugs, but at the very minimal dose, and try to improvise the child's lifestyle, introduce the school program, like classroom interventions, studying interventions, giving a short notices, giving short breaks, and getting accustomed and following the needs, giving a short attentions, short spans of work, and giving us small breaks. So by doing this, many of the children cope up till 6 years, and after 6 years, if the hyperactivity or ADHD is in moderate to severe, if it is moderate to severe, then we think about the medication. But the mild, I still prefer that you can manage it with the other modalities.
And how about the nutrition play the important role during this
Nutrition,
journey?
yes, nutrition plays a very important role. There are many non-evidence-based studies, in particularly in autism spectrum disorder, that camel milk, gluten-free diet, and all not things have been introduced, and then they stop kid from eating normal nutritional food, and then they prefer giving gluten-free diet and different camel's milk and all such things, and deprive them from normal nutrition, and then they give B complex, they give calcium and all that. Yes, the supplements are necessary. Sometimes because of lack of supplements, child's normal functioning is not possible, so you should be giving the supplements, and best is the balanced diet. The initially when you used to get the seasonal diets, which is really best for the child. So making your child eat what is available, fruits, vegetables, and milk, everything. But if you say that 3-year-old is drinking only milk, it is not right. So as age appropriate, your diet should be changing, but it should be a balanced diet.
One parent is asking how often we should visit a pediatrician. Is it only for a normal checkup, or we should be also watchful for this child?
Yeah, that's what I mentioned in my developmental screening, that you every visit when you go to your normal pediatrician for your vaccination, you should be talking with your pediatrician and telling the milestones, or naturally even your pediatrician will be asking for the milestone. And if you feel that the child is lagging behind the milestone, don't just sit that it will achieve after a month or 2 months, or maybe particularly with the speech. They say ki father has spoken late, so bacha bhi der se bolega. No, no more. You need to intervene. I'm not saying that start therapies, but at least intervene and get an idea of stimulation, and you can do it at home. So, first thing, for every immunization visit, you should be talking about your child's milestone. And secondly, as I told, that developmental screening at 9, 12, 18, 24, and 36 months, you should be doing, because 18 months is the window period for autism spectrum disorder. So, if the early you catch, the good the results are. And I think most of my patients are, they themselves are witness that they come early and they see the effects within an year because of the early stimulation.
Ma'am, I think that correlates to another question. So what will happen when my child is too old for the program? How can I see a transition in my child?
Sorry, I didn't get this question.
The question is like, if the child is little old now, whether the child has missed the bus or there is no work is possible.
See,
for
again,
the
it depends on the case, that how old is your child and how much is the severity of, and what neurobehavioral disorder the child is facing. For me, I know some parents miss the bus, but I say that wherever you find it, you start from there. Because as you know, that brain is a developing organ. It continuously, and I just showed the slides that stimulation in at any time can bring the changes. So bringing the changes is important. Maybe the minor or major effect you will see it. If you would have started it at early, definitely the outcomes are good. But whenever you find it, just start it. Even the minor changes, making him independent in his ADLs, can bring a very much big change for that child and for your family.
Absolutely, ma'am. And I think there are a couple of more questions related to vaccine. And
I will just check with him if he's coming back, but I don't think so. So we can, is it
Well,
fine if they answer?
one of the question is if the vaccine of if vaccine is available for corona, how will it be impacting the age-wise population?
If the vaccine is for corona.
It's precisely for different age group,
Mm-hmm.
whether for the adult or for children.
Yeah, that's what he mentioned, I think, in his talk. Just give me a minute. Are you coming to answer the questions?
Like 5 minutes, 10 minutes लागतील.
You'll be back in 10 minutes?
10 minutes,
Okay.
yeah. The child is arrested, so I'll just sort of and come.
Okay, that's fine. He will be back in 10 minutes, but I don't know.
Okay, I feel
Yeah.
we can have the answer maybe posted sometime.
Yeah, sure. See, that's what he said, that this corona vaccine is not, there is no child on which the trial has been taken. So we don't know the safety about the children. And as the Indian scenario, the children are not maximum who have been affected by the coronavirus. So children are the last in the list.
Fine. Ma'am, there is another question for you. Is it possible to do the stimulation at home?
Yes, of course. That's what I meant. Early intervention is you take the advice from the professionals, but you have to do stimulation at home. That is what, because that's what 15 to 25 hours of intervention is needed, and you cannot go for that many hours for therapies. So taking a proper advice, taking a proper guidance from the professionals and doing at home is very, very possible.
I'm pretty sure why the parents are asking this question. This is the time still they want to be at home, and that's what is recommended as well.
Yeah.
Ma'am, this is I'm the best mom is a platform where we have been trying from the April onwards to do maximum wellness program for the children as well. So I would also request the attendees, please do join the yoga sessions, which is there every day for the children in a very, very fun playway method. We are conducting a lot of programs related to language also. And there are 2-day session where the French language has been taught from US to the children who are interested. Then we have attention to emotion as a series which is going on. Various experts across the country are coming and sharing their inputs. It's a beautiful way to learn more about different aspect of child's journey and nutrition. And not only nutrition as an advice, but as a recipe form as well. We have a beautiful ebook is also available for everybody. So these are all coming free. You just need to get a copy of it from the website. Ma'am, just to share with you, we have just concluded one of the art virtual competition where more than 800 children have participated for the spread of early diagnosis of autism spectrum, and which is more than 7,000 people have voted for it. And this is probably one of the highest in the world standard where we have received this much of response. And I would request all of you can come and see the children which they have and the adults, various artists from different country have participated. Please go through those art pieces as well. And
well done. Very nice.
Yeah. So we have been trying to do as much we are able to do for children and parents as well. Now, before we conclude the session, there is another question from Dr. Abhijit Bhagat. Up to which age child brain will be completely developed?
See, the child, as I told you, the brain is a dynamic organ and it keeps on developing. It's from the conception till the end. But the maximum growth is seen in the first crucial age of life, first few years.
Right, ma'am. So we will be keep interacting through the platform, and I'm extremely thankful to all the attendees today, and to you, ma'am, and Dr. Sumant. He is busy.
I'm sorry, he has to leave in between. But
No, ma'am, I
if
think
the
that's,
vaccination questions are there on the platform, I'll make sure that he answers them.
we will
Yeah.
capture those questions and put it
Yes.
up in the website,
Sure, sure.
because that is in very much in interest to many of us. So thank you so much, ma'am, once again, and
Thank you.
it was a pleasure having you today.
Yeah, thank you for inviting. Thank you.
Thank you so much.